Welcome, folks, to the Joint Conference Committee for Laguna Honda Hospital for October 8th, 2024. Let's see. Can we
Yes.
have the roll? Yeah.
Of course. Commissioner Chow?
Present.
Commissioner Green?
Present.
And Commissioner Guillermo?
Present.
I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. A second item on the agenda is the approval of the September 10th, 2024 minutes.
Okay, thank you. You have the minutes before you.
And move approval.
Second.
Okay, is there public comment?
Is there any public comment on the minutes in the room? There's none here, but there is there are two people who obtained remote public comment permission. Everyone, we're on item 2, the minutes. Please let me know by raising your hand if you want to comment. I see no hands, so we can do all in favor?
All in favor? Aye.
Thank you. Now we can move on to general public comment, and there is someone in the room.
We have one person here from the public, Jim McAfee.
And Mr. McAfee, when I mention time, know your time is up. I have a timer in my hand.
I noticed that Jennifer Coate-Wade is not on staff anymore. Me and Jennifer Coate-Wade are not strangers. It's not surprising she's not on the staff anymore. I suggest you contact her and ask her what Jim McAfee called her about and what kind of treatment we had gotten. My domestic partner, I have durable power of attorney, and I'm his domestic partner, Randy Welch, South 2. Contact her and ask her what happened and why she could never contact me back. Also, it says here that my public comments before were that I stated that residents did not participate in the recertification process, only staff did. CMS only reviewed employee-related surveys. That's not what I said. The state did surveys with employees only. They were the ones who decided whether or not Laguna Honda got recertified, and they informed CMS. Any surveys that CMS did, when they occurred, were kept secret in order to keep them fair, meaning that no one knew about them, that there were surveys going on, in order that it would be fair. No, it's a biased process. The public is having a biased process fostered upon them. They don't know that families and residents didn't get to participate. We were stopped. We were stopped from participating. Not just that we couldn't do an interview. They told us we don't have standing. I have durable power of attorney. I'm his domestic partner. He's a conscious human being. And we don't have standing. At Laguna Honda, there was 4 signs on a room that said, CMS Laguna Honda Recertification Incident Command Center. Anybody want to explain what that was? No one can. Didn't exist. There was no one there. Ever. Ever. I was lied to several times by staff that there actually was somebody there, and there never was. This is where people had their lunch to get away from other people. Thank you.
All right, thank you. Is there any remote public comment on general public comment? We're on item 3. All right, I see no hands, so we can move on to the executive team report. Give me a second to pull it up, please.
Okay. Welcome, Diltar.
Oh, sorry. Okay, you can begin, please.
Good afternoon, Commissioners. My name is Deltar Sadhu. I'm the interim CEO and nursing home administrator for Laguna Honda, and I look forward to providing you our monthly update. So the new admissions to Laguna Honda continue to go very well. We're open to all priority groups. We're admitting between 1 to 5 new residents per week, and the pace increasing slowly. Since resuming admissions on July 31st, we have admitted 7 former residents and 13 new residents to Laguna Honda. And there's currently 4 approved applications with admissions coming this week. There are 6 pending applications in the review process, and we have denied total of 12 applications that were not meeting our admission criteria or not needing skilled nursing care or having the needs that we can't adequately meet at Laguna Honda Hospital. We thank all the teams involved in admission planning and our unit staff for ensuring each new admission is a success. We look forward to continuing to welcome new residents and update the public on the process. Next slide. In regards to sustainability planning, we made extensive improvements facility-wide during our recertification process. Those improvements included almost 1,000 milestones in the action plan. It's critical that these improvements are sustained to ensure our long-term success. To that end, in the May of this year, our health network leadership presented a Laguna Honda stabilization and sustainability plan. And now we share that a key component of this plan will be implemented in the coming weeks. We're partnering with HSAG, Health Services Advisory Group, to serve as our CMS regulatory expert for a series of evaluation. As you may recall, HSAG also served as the CMS's quality improvement expert who assisted us with our recertification process. As part of these evaluations, we will host an extensive organizational assessment which includes a mock survey component. Mock survey is a proactive tool to ensure that we're ready for our pending certification survey. Mock surveys are often used in preparation for recertification surveys. We will respond to the mock survey findings with a plan of correction and a root cause analysis. A comprehensive assessment now will ensure that we're ready for an on-site licensing survey and there's no surprises when surveyors are on site. We look forward to this opportunity to highlight our excellent care and the continuous improvements. Next slide. As part of the recertification process, Laguna Honda was required to convert all triple rooms to doubles to align with the 2016 CMS requirement. This resulted in a loss of 120 beds that were taken offline. We are committed to again recertifying those 120 beds via waiver process. We continue to make clear that we need to recertify the 120 beds to CDPH and CMS. In turn, CDPH and CMS have made clear that they're prepared to receive and consider a waiver application once we have demonstrated a sustained period of regulatory compliance. At this time, we're still in that period of demonstrating regulatory compliance, having been fully recertified for just over 3 months. We'll submit the waiver application at the earliest opportunity to ensure success, and we'll continue to be in touch with both CDPH and CMS. Now for COVID and flu vaccine update. As you know, the fall is here, although it doesn't feel like it. For the last few days, it was very hot. In preparation for flu season, and the anticipated increase in COVID-19 cases over the holidays, we have begun our annual vaccine campaign. For staff, we're hosting a series of clinics in coordination with Safeway Pharmacy. The first clinic began yesterday with over 200 staff in attendance. We have 3 more planned before the end of the month. For our residents, we're completing the process to secure consents and provide education to the residents, and we anticipate that the vaccination will begin next week. We'll go to each unit to make the vaccine convenient for the residents. We'll report our COVID and flu vaccine progress next month. We have done this successfully in the past and look forward to another successful rollout this year. Next slide. So update on COVID. Thankfully, COVID-19 transmission at Laguna Honda remains low. We have fully ended outbreak status for COVID-19 as of August 27, 2024. As of today, we have no units on outbreak, and there's no active cases in staff or residents. As a result of low transmission of COVID-19 in the community and at Laguna Honda, we have decreased the masking requirements. Masking is only required in the resident care areas, during resident transport, and at large group activities, but not elsewhere in the hospital. We remain responsive to the situation and will increase precautions as needed. Next slide. So this is our regular state of the hospital slide. So in September 2024, we had 11 new admissions, 1 planned discharge, 0 unplanned discharges, and 1 expiration. Our average daily census was 410, with our new admission line continue to climb upward. Before we go to questions, last slide. Thank you. Before we go to Q&A portion, I want to introduce Ami Fishman, the Interim Chief Experience Officer at Laguna Honda Hospital. As I mentioned last month, this is an inaugural role and is a key part of our ongoing effort to enhance the care experience for our residents, visitors, and staff. Ami brings over 25 years of experience in public health, equity, anti-racism, and social justice strategy and curriculum development. She has been a cornerstone of our efforts to foster a culture of belonging. I want to turn it over to Ami for a brief introduction before Q&A.
Thank you so much, Diltar. And hello, commissioners. It's great to see you again. I just wanted to say hi in this new role. I'm very, very excited to be our interim chief experience officer and really looking forward to bringing together all of these different aspects of care experience, from our grievances and spiritual care services to our lobby experience, as well as our workforce experience and engagement and equity. So you'll be hearing more from me in the future, but I just wanted to say hello in this new role, and thank you so much to Diltar and everyone for the support as I'm coming into it. Thank you.
Thank you, Ami. We're excited to have you in this new role, and I will take any questions you may have. Thank you.
Thank you, Diltar, for your report, and welcome, Ami, to the to the new role. Wish you all the success. It's an important position, so looking forward to hearing more from you. Are there public comments?
Hi, is there any public comment in the room on this item? All right, there are 2 hands. I'll be right there. Let's see. All right, we'll take the first caller. Caller, please let us know your code and who you are.
It's Patrick Monetshaw, code AA.
Okay, please begin. You've got 3 minutes, Mr. Monetshaw.
All right, thank you, Mr. Morowitz. Here we go.
Today's executive team report bragged shamelessly that in the 3 months between July, August, and September after LHH resumed admissions, LHH has admitted a total of 18 patients, 7 returning patients, and 11 new patients. But as the state of the hospital report on page 7 of today's presentation, it shows that LHH had 4 planned discharges plus 8 deaths of residents across those same 3 months. FO9 are a total loss of 12 residents. That means LHH has seen a net increase of just 6 residents. That averages just 2 admissions per month, which is shameful. LHH's patient census as of September 22nd was just 419 residents, down 291 residents since LHH's census of 710 patients on October 14, 2021. At a net gain of 2 residents per month since admissions resumed on June 20th, it will take fully 12 years to get back up to a census of 700 residents. Delay in admissions each week and each month directly translates into San Franciscans needing SNF level of care will continue being dumped into out-of-county skilled nursing facilities. Thank you.
All right, thank you. There's one more hand. Dr. Palmer.
Hi, it's Dr. Teresa Palmer. I'd like to address Ms. Fishman and Mr. Sidhu. Part of the care experience is really needing a nursing home bed in your own community and not being able to get one. And I know that Laguna Honda, to some extent, has a waiting list because in 2017, my mother was on it. We need transparency about who's applying and eligible for a bed and not getting one. And this will serve a couple purposes. It will let us know if the admission process is sufficiently efficient to encourage San Franciscans in need to apply, and it will let us know also, it'll clarify who's end up getting dumped out of county for lack of nursing home beds and why. At the rate of 6 admissions in 3 months, there has got to be an increasing waiting list of people who qualify, whether or not they're high priority, they do qualify to come in. And so as Dr. Chow requested at the last Health Commission meeting, we need a graph and we need transparency in numbers about who is waiting to get in. And not just, 12 people applied but weren't eligible on every month. We know that some people will wait, will be eligible, and will have no choice but to wait due to the fact that they've spent down to Medi-Cal and other beds are not available in San Francisco to them. And this will also inform the rate at which you should be admitting people. So please supply this information as the Health Commission requested. Thank you.
That's the last public comment on this item.
Okay, thank you. Are there any questions or comments from members of the committee? Yes, Dr. Chow.
Yes, thank you. I actually had 2 follow-up questions from our last month, one of which was alluded to already, which had to do with the fact that I think it's nice that you are able to break down the categories of people who were applying and what were the reasons. Some didn't get in and some did get in. I think rather than just verbally go back to that request that we sort of graph it out and be able to follow the trend, and how many were then also put onto a waiting list that were qualified, so that this can be more easily seen, because we understand that, you know, you're limiting your admissions. Maybe you're not anymore, but you were limiting admissions with the caveat that you wanted to be sure that you could care for the numbers that were coming in, first being admitted and then being absorbed into the system. So there may still be, there may now, I think you did mention last time there were 30 people on the waiting list. So I do think that it's helpful, continue to think it's helpful for us to understand what, you know, the demand is right now. How many then out of that demand, as you just pointed out, really didn't qualify? And those that did qualify, how many were able to be admitted and how many are still on the waiting list? So That was one follow-up. The second, and maybe you've already answered, is in terms of the RSV vaccine. Is that also then being offered to this population? I believe CDC just came out with new, clearer advice that people over the age of 65 should be considered as being eligible for it, rather than a consultation with their physician. So I didn't know if perhaps you've already answered Dr. Green on this, as was noted in the minutes.
Thank you, Commissioner Chow.
Those are the two questions maybe you want to first answer, and then I'll have two others.
Yeah. So in regards to the admissions, so far we have received total of 51 referrals in all 5 categories, and there's only 6 pending in our review process out of those. And we have denied 12 out of the 51 due to various reasons. Some, either they have behaviors that we can't manage, some may not meet skilled nursing criteria, so for various reasons. So at this time, there's only 6 pending that's in the queue.
6 pending in the queue, and does that mean that they are qualified and waiting to be admitted? Is that
They're in the review process. We have not approved them yet. So they're
okay. So they're not approved yet. They're
Yes.
still in the queue, working on being approved.
Yes.
So, so it sounds like you're pretty up to date on reviewing the applications, and that there is no waiting list at
Yes,
this point.
that's correct.
Okay, thank you on that.
And I'll call on our IPC team for the RSV vaccine. Melissa's online. Is Dr. Lam, are you on? Maybe perhaps you can take that one.
He is there. I want to meet you, Dr. Lamb.
Hi, I'm sorry. I'm trying to start my video as well for you, for the folks. Hi, can you see me? Can you?
Yes.
Yes, we can hear and see you.
Great. Yeah. So I have been taking a look at the new guidance for RSV, and certainly we'll get back to this group at the next meeting. I don't have a set answer yet, but I'd like to work on it with my team.
That's fine. Thank you. I had 2 other questions, pretty easy. One is actually who is going to be performing the mock survey, and I suspect I know the answer. But number 2 is also, we've been challenged with heat waves up at Laguna Honda. How did we do the last few days?
So in regards to the mock survey, it's going to be done by experts from HSAG. They're fully trained in the survey process, similar to what CDPH does. So they're trained and they're regulatory expert when it comes to CMS regulations as well.
Sure. We're of course aware of HSAG, and they're very aware of us. I will assume that the commission will receive a report on the satisfaction that we're assuming will be a positive in the survey process. So could you tell us how we did during the heat wave? I know in the past we've had some real challenges.
So we did well. The team was, we had a plan in place, which was activated. We were monitoring all resident rooms and all common areas to ensure that we keep residents safe. And we had no negative outcomes throughout the last few days.
Very good. So you were able to control the temperature, and you had the appropriate either fans or the air conditioning was working right and everything now?
Yes.
Oh,
and none of the rooms were above the regulatory compliance of 81 degrees usually. And we were able to provide, we had a cooling center set up as well if the residents needed. So we had plans in place that we executed on.
Well, very good. Thank you very much. That's
Well, thank you for the update. I had, first of all, I endorse what Commissioner Chow has said about getting more granular information about the admissions. Do you happen to know, and I know you haven't been at Laguna for this whole time, but do you know how long it would take to approve an admission and actually bring a new resident to Laguna pre-pandemic, pre-decertification compared to now? I mean, I know you're putting many more safeguards in place now to make sure that the individuals you do admit are appropriate and will get be qualified to get the care that we can offer at Laguna. But I'm curious to know kind of how our timeline compares maybe to what we used to do, and even what is there a norm for, there may not be, but for nursing homes to understand, I think setting expectations for both the public who testified, but also for families to understand what this process might be.
Yeah, I'll address that. Thank you for your question, Ms. Green. So one, the time frame may be different for each type of admission. Obviously, admission coming from a community may require more time than somebody who's coming from a hospital. But we do continue to work on looking at our processes internally and also any challenges externally that we can address to reduce the time frame we're taking. That's something the team is actively working on. So we could get kind of in line with the industry standard. Working with our network partners like Zuckerberg, they're typically used to 24 hours to 48-hour turnaround time with other nursing homes, and our goal is to get to that time frame as well.
Great. Yeah, we'd love to be updated, I think, on those aspects as well. Another question I had is, what's going on with TB testing? I mean, I'm sure you must do it for staff because I think it's a requirement, but do you test the residents?
Residents, there is a regulatory requirement. I'll ask our IPC team, or maybe Dr. Lam, you want to talk about resident testing. There is annual PPD requirements for residents as well.
I've unmuted you, Dr. Lam.
Hey. Yeah.
We're not, oh. It looks like you muted yourself again, Dr. Lam. I'm not sure if you heard the question.
No, I'm.
I think you might be having
some issues. Is there anyone else on the floor? Would Dr. Hu have that information?
Yeah, I'm happy to help with answer that, commissioners. We have an annual requirement for PPD screening.
Dr. Hu, could you speak up, please? I'm sorry to interrupt you.
Is that okay?
Yes, a tiny bit more if you could.
Sure. Oh, I've
That's
never
great.
been accused of having a soft voice. Thank you very much. I'm happy to answer this. We have an annual requirement for either PPD screening for those residents who are known to be PPD positive, or if for those known to be PPD negative, I apologize for that. If they have had known previous TB or a previous positive TB skin test, then we require a symptom review of all residents, and these are done annually. For new admissions, we also have a requirement for screening similar to that. Thanks.
Thank you. Thanks so much. Thanks. Appreciate Dr. Hu. And then, getting back to the admissions and the individuals who don't qualify, it might be helpful for us to hear a little more about the reasons some don't qualify. I mean, I think this circles back to some of the concerns of the public that we're admitting people who have behavioral health issues that really not only shouldn't be there, but can create the types of problems that led to the decertification to begin with. So I think showing that we're actually instituting our policies and being more thoughtful about admissions as opposed to this flow project by knowing some of the reasons without getting too much into HIPAA issues, why you've rejected some individuals would be really helpful. And then if they are, the other thing is, if they are part of our health network, what are we doing by way of disposition? How are we helping them? Because they may not get into Laguna, but they're ours. So it would be fascinating to know how we're managing those individuals as well. I mean, it may not be part of the Laguna Honda purview, but it might be helpful to know, because I think we care about everyone in the community and them landing in the place that's appropriate for their needs. So those are my only questions.
Thank you, Commissioner Green. Definitely, actually, behaviors has been one of the reasons we have denied several residents. That's probably one of the top. I can definitely get more information. Some residents not meeting skilled criteria or a long-term care criteria for skilled nursing facility where we feel they're appropriate for a lower level of setting other than skilled nursing has been denied as well. Or we are not able to meet their care needs. They may need a higher level of care than skilled nursing care. So those have been some of the reasons for denials.
Okay, if there aren't any more questions or comments, we can move on.
Great. We can move on to item 5, the hiring and vacancy report.
Thank you.
Good afternoon, Commissioners. I'm happy to present the staffing report for the month of September. Laguna vacancies stand at 7.12%, seeing a very nominal drop from the 7.47. We hired a total of 20 employees in various job classifications between September 1st and September 30th, 2024, had 4 separations during the same period with no retirements. We continue to prioritize and support the hiring of registered nurses. The vacancy rate currently stands at 1.5% for the month of September, which translates to 3 vacancies. And of the 3 vacancies, we're currently in the process of onboarding the selected candidates. With regards to nursing managers, or the 23-22 classification, we continue to move candidates through the selection process for the 3 remaining vacancies we have open. As I speak, we've completed the selection process and we're readying candidates for the onboarding process. There are currently 9 openings for the 23-12 licensed vocational nurses, for which we are in the midst of the onboarding process for the selected candidates. The HR team is also continuing to process vacancies within several classes through an efficient batch hiring process. At this time, we are currently managing batch hires for the Health Worker Series 2586 and 2587 job classifications. We are working through 23 vacancies across DPH across locations for the 2586 Health Worker 2 classification and 13 vacancies for the 2587 classification. The team is also currently working to fill 6 vacancies across DPH locations in the Health Program Coordinator 3, the job classification 2593 classification, and 31 vacancies in the 2430 or the medical evaluation assistant classification. As we look to fill vacancies across DPH, batch hiring, the process itself continues to help identify efficiencies and ensures a much better outcome for both candidates and hiring managers. The HR team continues to hold planning meetings with exec leaders and hiring managers on a weekly, monthly basis to go over the vacancy information and hiring plans. The hiring highlights for last month, RN highlights, 2 registered nurses started last month, and a non-RN highlights, we had 1 2303 or the patient care assistant who started last month, and 2 licensed vocational nurses and in the 2312 job classification that started last month. Thank you.
Thank you, Priya. Are there any questions or comments?
Let's see if there's any public comment.
Sorry.
No, it's okay. Any public comment in the room? There's a public comment in the room, and I see no hands, so you can continue with your discussion.
Commissioner Chow?
Actually misspoke, didn't you? You might have misspoke. I see in the report it says 3 LVNs were hired in the month rather than 2. So is 2 or 3 correct?
It's 3. It's 3.
Okay.
3 in the classification 2312.
Thank you.
Okay. Looks like things are moving along very well. And it just, it does seem as if the efficiencies that have been created with the batch hiring and just some of the stability that's occurring throughout the department as well as at Laguna Honda are really showing up. So glad to see things are doing well.
Thank you.
All right, shall we move on? Item 6 is the regulatory affairs report.
afternoon or good evening, commissioners. I will be reporting on Geraldine Mariano's behalf. So for the month, our October report, we are presenting the information for the month of September. Laguna Honda had 15 facility reported incidences shared with CDPH, and CDPH came on site to investigate 4 anonymous complaints with us, all of which had a outcome of no deficiency for the anonymous complaints. For the facility reported incidences, we are still waiting for CDPH to start their investigations. During the month of September, we did host CDPH for 2 site visits. One where they did the review of the 4 anonymous complaints, and the second at the end of the month was to issue the 4 Class B citations. It's really important to note that these citations were for deficiencies the facility was already aware of, plans of corrections already submitted, and all evidence of compliance also submitted to CDPH, which was accepted at the time of the submission of those documents. We have 108 pending cases since October of last year. These are all facility reported incidences, and this has been our lowest number for some time with CDPH. With that, happy to answer any questions or hear any feedback.
Thank you, Naz.
Oh, yes, we have 2 hands for
Okay.
up. Let's see. Mr. Minute-Shaw, you've got 3 minutes.
Thank you.
Today's regulatory affairs report is yet again shocking. The ongoing site visits section of this report reveals that CDPH issued 4 Class B citations against LHH, 3 involving facility self-reported facility reported incidents, and 1 for an anonymous complaint. My sense is that since LHH reported 2 separate potential privacy breach violations as facility reported incidents so far in 2024, that the Class B citations may involve patient confidentiality privacy breaches. But today's report doesn't say what the 4 Class B violations involved, when they occurred, and how much the citation penalties might cost. Since the report stated plans of correction were previously submitted and were approved by CDPH, I have placed a records request to obtain the plans of correction in Forms 2567. I received the records today, and it appears they were for violations that happened this year in 2024. And the 4 citations totaled $12,000. When ISS LHH going to stop receiving fines for patient abuse and neglect, accident hazards, and comprehensive plans? Thank you. Agenda item 7, LHH policies.
All right.
And
Let's see, we have 1 more. Dr. Palmer, you've got 3 minutes.
Hi. As a former nursing home doctor, I do understand that violations occur, but what's disturbing to me is the lack of response from CDPH over a long period of time to a huge number of complaints. And it would be, this bodes trouble for the future, because if you aren't getting feedback, then you may not right the ship. And I worry about recurrence of the mess that Laguna Honda has been through. So I'd appreciate it if that was addressed. Why is there so much delay, and is there anyone to appeal to or to clarify why there's so much delay in these CDPH responding to violations or complaints? I'm sorry, to complaints. Thank you.
That's the last public comment.
Okay. Any comments or questions from members of the committee? Dr. Chow.
Yes, I think this question continues to come up, and your answer is always the same. It's really a matter of up to CDPH, so I've stopped asking why we don't have any better backlog. And it appears even at General, there's a backlog of fries going back over a year. So I did ask, but apparently we don't really know the backlog and other types of facilities in the area, I guess. But it would seem, though, that I think is very commendable that on your most recent anonymous complaints that you're doing as well as you are. Those seem to get quick attention. and are appropriately evaluated. And for us, it's great news for your staff that there are no deficiencies. So I think those are key, and we can't control the state as to, I guess, what the state does. We've been watching these for several years, and we don't seem to make any headway. So I don't know how much more we can do, but I do take heart that in the anonymous complaints, it appears that we really have a good record right now of the numbers reviewed and that were found to not be deficient. So,
Thank you, Commissioner Chow.
Any others? Okay, I agree with Dr. Chow that it is a mystery that might never get solved, and hopefully we'll get some good news on the backlog sometime soon. Okay, let's move on.
Sure. Thank you, Naz. Item 7 are the Laguna Honda hospital policies.
Carmen is just walking to her office, so let me go ahead and start out of the interest of time. My video is still on? Yes, okay, perfect. So good evening, commissioners. On behalf of Carmen Trin, we have a total of 17 policies seeking your approval this evening, 9 hospital-wide, and they are with revisions. There are also 8 departmental policies, 7 with revisions, and 1 requesting deletion. Want to share 3 updates with you in regards to the policies as well, based on your review and feedback, which we're always grateful for. 20-01, the admissions to Laguna and relocation between the units. We are adding verbiage there to capture when we need to relocate our residents with COVID or any other diseases to designated units, so that is clear. In addition, for 2004, the discharge planning updated from MD to MD to physician. Thank you, Commissioner Green, for that feedback. For 5003, pre-admission screening added within 14 calendar days to MDS significant change assessment to be clear. Thank you, Commissioner Chow, for that feedback. So seeking, I guess, referral to the Health Commission for full approval of the policies.
Thank you, Naz. Is there public comment?
There is a hand.
Hi, Bart.
Hi. Dr. Palmer, would you like to make comment on the policies?
Oh, no, I just didn't put my hand down. I'm sorry.
Okay, thanks. Okay, that's all.
Okay, from the committee members?
well, I think for myself, the questions that I had asked were responded to quite well, and these appear to be in order from my review.
Okay, Dr. Green?
No, thank you also for your responses to our questions, and I think you've satisfactorily answered all the ones I had.
Okay, so I think this is the first time in a while that we've been able to request a vote to fully recommend the policies as submitted to the full commission without asking for additional modifications prior. So can I have a vote, motion?
So moved.
Second?
Okay, aye.
Great, thank you so much. The policies will be on the consent calendar at the meeting on Tuesday. Next item on the agenda is consideration for a closed session.
Okay, can we have a motion?
So moved.
Second?
Okay, all those in favor?
Aye.
And I'll note there was no public comment request for that. So folks who were from the public know that we will be back after the closed session, but you will not hear or see us while we're there. Thank you for your comments, and we'll be back. Commissioners, please consider a motion to disclose or not disclose discussions held in closed session.
Move not to disclose.
I would second.
All those, I'm not going to say it again, sorry.
All those in favor? Aye, say aye.
Aye.
Please consider a motion to adjourn.
So moved.
Second?
All those in favor?
Aye.
Great.
Okay.
Thank you, everyone.
I'd say the heat is getting